All right, I've got 2 minutes after, and I see Geneva has started the recording for us, so I'm going to go ahead and jump in. Good morning, everybody. Like she said, thank you so much for joining us for our tenancy preservation overview today. So let me get the slideshow going here. All right, so first, just an introduction to our tenancy preservation team, which is comprised of our tenancy stabilization coordinators and our eviction prevention specialists. So representing the Mecklenburg area, we have John Kyler as an eviction prevention specialist, Sekhmet Bey, who is a tenancy stabilization coordinator, and then Desiree Brown, who is also a tenancy stabilization coordinator. In our home region, we have Angela Boyd, who is an eviction prevention specialist, and then Latasha Bynum and Cicely Steele as our tenancy stabilization coordinators. I know it says specialist under the tenancy tenancy stabilization titles, but it's actually tenancy stabilization coordinator. Apologies about that. So really, how does the tenancy preservation process get started? And it begins with that initial tenancy issue that's reported to us. So once we are identifying a tenancy issue that may lead to a tenancy separation or eviction proceedings for our members who are in the Transitions to Community Living program, we will then complete that referral to involve a tenancy stabilization coordinator or eviction prevention specialist. And after they are assigned to the case, they will complete information in our tracking spreadsheet and schedule a tenancy preservation meeting review of the case. After that, within 7 days of the assignment, they will meet with the member, provider, and team to create a housing stability plan. They'll continue to follow up with the team for 14 days to gather any updates on the housing stability plan. And also simultaneously, they'll have that presentation in our tenancy preservation meeting. If the tenancy concern is resolved, the tenancy stabilization coordinator or the eviction prevention specialist will close the case. If it's not resolved, a second team meeting will be scheduled to create a housing retention plan. The plans and interventions will continue for the next 30 days with support of the tenancy stabilization coordinator and the eviction prevention specialist. And hopefully, again, trying to achieve that resolution, we would then close the case if it is resolved. If not, we will start to negotiate alternatives to eviction. So this may be voluntarily vacating the unit or moving forward with a rehousing plan. So we never want to start with rehousing as the goal for tenancy issues that are reported. We always want to try and deploy any alternatives or supports that can prevent that separation. And then once the rehousing plan is approved, the member will begin search for new housing. If it's not approved, then we'll explore additional alternatives. So how are we getting those tenancy issues reported to our team? So they can be identified for tenancy preservation supports when alerts are submitted through the client care web platform. This is the provider platform that is used to complete monthly checklists with members for any of their monthly visits. So a provider can simply log into the client care web, enter their data from their monthly visit, and depending on which information is captured, they can be referred for tenancy preservation supports. Anyone can also complete an internal submission of the eviction prevention referral form. And there are also times that we'll identify a member need through a communication from DHHS, the North Carolina Housing Finance Agency, NCHFA. We also identify tenancy-related support needs through our housing specialist, through contact with myself and Cliff, the housing managers. It can be from a property manager, a landlord, a care manager, or a transition coordinator. But anytime it's an internal team member, we do ask that they complete the eviction prevention referral form and submit the form to the tenancy support mailbox. So this is what the eviction prevention referral form looks like. So there are service risk factors, healthcare concerns, housing concerns, social support, income issues, or even engagement issues. There's also a spot for other. Generally, we just like to see that one of the previously identified boxes are selected. Other can cover, any extenuating circumstances that we may not have identified there, but generally it will fall into one of those issues identified above. And we do like to know as much about the concern as possible. So, for example, if somebody has rental arrears or is behind on their payments, we want to know why. Was it because they maybe had to help pay for a funeral for a loved one? Or do they have a gambling concern? What is that root issue that caused them to be behind on their rent? It wasn't just that they didn't pay rent, right? So we want to know as much information about the identified concern so that we can help get that member assigned to the appropriate specialist. And then SecMet is going to check in with you guys for a knowledge check. Feel free to use the chat to answer too.
All right, so to submit a referral, true or false, the TC or the TCL CM should complete an eviction prevention referral form, which is located on SharePoint, and submit that to Tenancy Support at AllianceHealthPlan.org mailbox. Is that true or false? You can put it in the chat what your answer is. All right, looks like most people are saying true.
That is correct. So yeah, an easy one there to get us going. If you want to submit a referral, go ahead and complete the eviction prevention referral form and send it into our tenancy support mailbox.
Stephanie, I did see a question. I think, are we doing questions as we go or should we wait?
We can take a break for a question. Sure.
Okay. Eva, if I'm saying your name right, did I see your hand up or was that question answered? Because it's now it's not up anymore. Your hand.
Yeah, I asked it in the chat and it was answered. I had asked if this was for TCL members only.
You know what? Yeah, because I just answered your question. Okay.
Correct. Yeah.
Okay.
Thank you.
All right.
Thank you. Yes. So currently this program is only for members who are in TCL. All right. So who gets assigned? Is it a tenancy stabilization coordinator or an eviction prevention specialist? So as you can see, we've got the onset of the process with the issue being reported. That eviction referral form has been filled out, or we've received notification of a member issue. If that issue is behaviorally based, so if it involves active psychosis, substance use disorder, maybe some poor housekeeping skills, they've abandoned their unit, they're smoking, there's a neighbor disturbance, then that will be a tenancy stabilization coordinator that will be assigned to the case. If it is a housing-based concern, like unpaid rent, unit damages, complaints or concerns with the landlord, or maybe even a landlord or tenant conflict, if there are some health and safety concerns, an example here would be like mold or something like that, then or an emergency inspection is needed, then that issue is going to be assigned to an eviction prevention specialist. So tenancy stabilization coordinators are going to handle behavioral-based concerns. Eviction prevention specialists are going to handle housing-based concerns directly related to that unit or unit maintenance. Obviously, there are going to be situations where both supports are needed. So there might be situations where a member has behavioral issues that have caused unit damages, or behavioral issues that have led to rental arrears. And in those cases, we will team up and have a tenancy stabilization coordinator and an eviction prevention specialist assigned to support that member. All right. So who is involved in the process? So the issue occurs. if it's in the first 6 months of tenancy, it's going to be the transition coordinator that's a part of that team. If it's 6 months beyond, then it's going to be the TCL care manager. If the member is kind of in the process of transition from the transition coordinator to the TCL care manager, we might involve both members. So we kind of operate with, having a well-informed team, and whoever knows that member best. If we want to have supports, if supports are needed from both the transition coordinator and the TCL care manager, we might involve both in the eviction prevention or tenancy preservation process. Who can assist with other supports outside of the the tenancy stabilization coordinator or the eviction prevention specialist? So if it's a reasonable accommodation, we would support that with our supportive housing specialist. There is a reasonable accommodation email, ra@alliancehealthplan.org, where we have our housing specialist, Kaleem, that provides support for our reasonable accommodations. If it's related to a biennial certification or an annual inspection, it's going to be our subsidy team or subsidy administrators. So depending on what the exact concern is, we may involve these other supports as well. Sekhmet, we've got another knowledge check. Take it away.
So everyone referred, this is true or false question. Everyone referred for tenancy preservation supports will be assigned to a transition support coordinator, eviction prevention specialist, or both. Is that true or false? Answers in the chat. The question is, everyone referred for tenancy preservation supports will be assigned a TSC, EPS, or both. Is that true or false? Got a couple of trues, a couple of falses, more falses.
Thank you, Sekhmet. So that one is false. So not everyone who is referred is going to be assigned for tenancy preservation supports. There are situations where we will not involve a tenancy preservation team member. Most often, these are because the member is no longer in tenancy. They have to have some type of tenancy for the tenancy to be preserved. So we would not get involved in a situation where the member has already been evicted or something has already kind of come to pass. So not everyone that we receive referrals for does get assigned to our team. All right, and then we have the tenancy preservation meeting. So this is a weekly meeting that started back in April. This is hosted by our tenancy stabilization coordinators and eviction prevention specialists. They will assign members that we've received referrals for a case review and discussion on kind of what needs to happen or what's happening within these situations. So we do send out a weekly agenda in advance so that you know if your member is being discussed. And these meetings replaced the previous tenancy concern meetings that were called the separation meetings. So we've had a lot of good discussion and conversation in our tenancy preservation meetings. They seem to be a great benefit for just making sure that we have that team approach and that everybody gets kind of multiple forums to continue the team effort to support these members. The housing stability plan. So this is one of the plans that our tenancy preservation teams use. The housing stability plan is an action plan that is designed to assist the tenant with identifying what the issues are and developing action steps to address those issues. So it'll clearly describe the actions required, what the lease violation is, what the concern that caused the referral may be. And usually there are multiple concerns or issues that are coming up. Usually we find that it's not just one thing that's been identified. It's usually kind of like multiple behaviors or situations that we need an action plan to address. So the housing stability plan will be used to kind of identify those action steps and who's responsible for each part of the action plan. The retention plan is also an action plan that is there for somebody who's maybe having ongoing concerns. So the plan for the ongoing concerns, will identify the lease violation or the issue being addressed, and then it will provide education to the member, ensuring that they are aware of what the violation was that occurred and what their responsibilities are in the lease violation. And then this also identifies action planning and steps that the team will take to continue to support the member in resolving the issue. So it might be, each member has a different step, or each team member has a different step. The member might be responsible for one piece of the puzzle, while the tenancy stabilization coordinator is assisting with the care manager on identifying some services or changes that might be needed. It's going to give a full action plan for each person on the team. And then it's also going to determine the follow-up needed, including when, where, and how it will occur. All right, Sekhmet, another one.
All right, so when I complete a referral for tenancy preservation supports, I do not need to be involved in the process or the action plan. Is that true or false? In the chat, please. And most people are saying false.
Yes, that is correct. So the tenancy preservation team is not coming in to fix the situation and then leave. We are coming there to partner with the team and the person who completed that referral. So whether it be the transition coordinator, the care manager, even like the landlord or whoever identified that initial issue, they're going to be involved in the process throughout the process and the action planning. So yes, we want that involvement from everybody the entire time. On occasion, though, however, despite our best efforts, there might be issues that continue to persist. If it becomes evident that the tenancy cannot be saved, the eviction prevention specialist or tenancy stabilization coordinator might begin negotiating alternatives. So this might be a non-renewal of the lease. We might ask for early termination of the lease with no financial penalties. We also might relocate the member to an alternative housing location. This again could include if a member voluntarily vacates to avoid eviction. We might also use our reasonable accommodations to request for an accommodation that allows a member to leave the lease. So just depending on what the concern is, we do start to negotiate alternatives so that we can avoid an eviction being added to that member's record. And at this point, this is where we kind of start talking about the rehousing plan. So before an individual gets to the point of rehousing, we really want to talk about increasing supports and services. So if their ACT team is coming once a week or once a month, we might want to talk about coming, 2 to 3 times a week and really wrapping that member tight in services. We also would have an honest conversation with the member about what rehousing requires. Rehousing is a process. It doesn't happen overnight. It's just the same as if you and I were moving. We have to have time for packing. We have to coordinate finances. We have to think about where we're moving and coordinating all of that process. It isn't something where we would just say, all right, I'm moving, and you expect to be in your new house tomorrow, right? So making sure that our members are understanding that it is a full process. Also discussing with them the availability of alternative housing. So would they be interested in going into one of our bridge programs, our community transition recovery program? There's also some additional new programs under our bridge housing that might be available to those supports or to those members, excuse me. And then talking with them about natural supports if none of these options are available. If they don't have alternative housing, do they have natural supports that they'd be willing to stay with? Are they interested in shelter? Would they want to go to a detox program? Is there another type of transition that they might be interested in if bridge and hoteling is not an available option? It also costs money to move. So making sure that we're talking with members about moving, storing items, and the purchasing of new items in case our TYSR funds are not available or approved. And all of this all of these conversations are occurring because we want to have a thoughtful move and rehouse this member with an action plan or step-by-step plan. So we don't just want to encourage them to take whatever the first available unit is if it doesn't meet their needs. If they, have an ankle injury or a medical concern, we don't want to put them on a second floor unit just because it's available. We want to make sure that the unit is accessible and meets their needs. Sekhmet, take it away.
All right, so true or false, or sorry, which one you gonna pick, A, B, C, or D? When submitting a referral for tenancy preservation supports, you should also consider A, submitting a rehousing plan, B, submitting a referral for community inclusion if appropriate, C, submitting a referral for Nourish RX if appropriate, or D, B, and C. In the chat, which option, A, B, C, or D? Okay, I see a lot of D's.
Excellent. Yes, D is the correct answer. So as we were mentioning earlier, we don't want you to come into this process with the idea of rehousing being the goal. The goal is to preserve tenancy at the current unit and continue a long-term tenancy for that member. Some of our other great supports that we have available are going to be the community inclusion program and community inclusion providers we have. We also have our Nourish RX program that provides support with food insecurity. So lots of great opportunities to get that member involved in their community, to get them other supports, but we do not want to start with rehousing on the brain. So how do we wrap up this process? Once the tenancy preservation team becomes involved, they are there with the goal to be there short term. So it is a short-term support that they come in, and ideally within 45 days or less, they are going to be completing this closing summary or warm handoff. And the closing summary or warm handoff is completed when the resolution has been achieved and the tenancy issue has been resolved, or the member is no longer engaged, and or they've said, I don't want any help from tenancy preservation anymore, or the member has received all of the supports available and every avenue of resolution has been exhausted. So we really try our best to ensure that we are not creating kind of like a crutch or lengthy process for members. We are wanting to kind of get in, get out, and as a part of that get out process, we provided this case summary or closing summary for the team. So it'll identify any concerns that were worked on throughout the tenancy preservation process, what supports were utilized to address those tenancy concerns, any type of maintenance plan or action plan that needs to continue occurring so that the member does not risk their tenancy again, and who that person responsible is. There's also a section for any available resources or resources that the member was connected to in the process that assisted with that identified concern. So this kind of ties everything up with a nice bow of like what occurred, what were the issues that were addressed, and what that maintenance plan would look like for the member and the team to continue with a successful tenancy. And that brings us to the end. And again, this is an overview of the tenancy stabilization and eviction prevention teams. If you have any questions, definitely we're going to stay on for a little bit. So feel free to come off mute and or get in the chat and we'll be able to address anything that comes up. Thank you so much. You're on mute, Geneva.
Oh, thank you. Great presentation. Thank you for providing us with that information. Again, at this time, would anybody have any questions for Stephanie or Sekhmet in regards to the tenancy preservation process? I guess not. Okay. Well, if you haven't done so, please put your name,
There's a
email.
question. There was
I'm
a
sorry.
question. Yeah. Okay,
hold on.
Desiree's asking, can a provider send a referral? Good question.
So the best way for a provider to link to our supports is just to contact their alliance contact, the care manager, or if they're working with a supportive housing specialist or anybody that they have a strong relationship with regarding the issue, they can complete that internal referral form. But as long as you're making somebody aware at Alliance, then they should be taking that step and completing the referral form on your behalf. Great question, though. Yes. And that might be also one of the ones that we mentioned earlier where it was like we find out about an issue and we go ahead and assign it to the team. So even if if we become aware of a situation, then we would definitely have the appropriate supports involved. Most likely the provider is going to notify us through that client care web system when they're completing their monthly checklist. So that's typically how we're getting the issues identified from the provider directly, but they can also contact Alliance and just let us know that that support is needed.
Thank you for that question, Desiree. Does anyone else have any other questions regarding this process? Okay, well, we will go ahead and start transitioning. I think we have another. Would the Tenancy stabilization coordinators be able to assist TCL members who are currently using Section 8 vouchers with resources or community service, for example?
So, Alexandra, I think I'm understanding your question. So we can help the members in TCL regardless of the funding source. So, whether it's a voucher or Section 8 mainstream voucher, TCL, no matter what it is, we can help. But we wouldn't necessarily there has to be a tenancy issue there that's jeopardizing that tenancy. So we wouldn't be added in just to provide community resources, but if we are there to address a tenancy issue and there are needed community resources, we would help identify those. Yes.
Okay, we have another question from Felicia Daniels. How long does a process potentially take? We have individuals that has been going through the rehousing process for over 6 months. Does it typically take this long?
Sure. So the rehousing process, it really is individual specific. In every timeline, it's different. It depends how that individual is identifying a new unit. The tenancy preservation process itself is going to be that ideal time frame is going to be 2 months or less. So really that 45-day window, we're hoping to get in and provide those supports. Rehousing is a different process. So it depends on when the member is planning to vacate their unit, when they've identified a new unit. There's a lot of factors to rehousing that can lengthen that process.
Yeah, just a reminder that our main goal is to prevent rehousing. Like we're in the business of maintaining tenancies. Just want to throw that out there.
Great questions.
Thank you. And I just wanted to kind of further add on to what Sekhmet said. We'll still provide support in the rehousing. The tenancy preservation team will not be providing support in the rehousing process, but we will still provide support from the housing team with, vacancy listings and things like that, as well. So it just depends what the holdup is really. Is it there? Every situation is different. I know Cliff's going to come in and add some great detail here, but like Sekhmet said, the goal is not rehousing, but there are times where we are looking at rehousing, right? And where we're wanting to be in that situation. Ideally, we don't want rehousing to drag out 6 months or longer or be a long process because member needs and things are changing. So we want rehousing to happen as soon as possible if we do get to that point.
Stephanie, she's referring to the whether it's approved or not. I guess once they submit, they're waiting for that approval from you all. I think that's the process she's talking about, Felicia, in the chat.
Gotcha. So, yep, go for it, Cliff.
Okay, it's burning. So back with the eviction prevention. So they're coming in not thinking rehousing. They're thinking of saving the housing. Now, if it's unable to be saved, there's going to be things put in place. There's going to be, the plan to maintain housing, or there will be a plan in place which would help when you do the rehousing plan. So you can veer off of that because there's a lot of work done before you're going to work on rehousing if someone ends up being out of housing. So you can utilize that plan as well when you're doing the rehousing plan. When you do the rehousing plan, it will take generally, if you guys submit it to the care manager, they get it to us. I know it's within a week. I think, Stephanie, are you within a week? I'm every Monday morning, so you'll have it. So within a week, we'll approve it. Now, with that, as Stephanie was saying, there's barriers that may come about. So that's where you, as well as providers, members, care managers, trying to work towards that housing thing. I suggest providers get to know your property managers. Don't always depend on alliances properties as well. Like, get to know your property managers, and that'll help you with your members as well moving forward. But yeah, that just depends on if you're just putting in targeted housing referrals. That can be anywhere from 1 day. I've seen one that last week it was 2 years ago that someone submitted one. So it depends on what properties you're going for and where they're at on the wait list, which we don't know if it's targeted.
And Felicia, I'm seeing kind of the comments that you're putting in the chat. So, yeah, if an individual is approved to rehouse, like as soon as they receive that approval for rehousing, we want planning to start occurring, like Cliff was discussing, like when that lease is ending, hopefully moving directly from one unit into the next if they've been approved. So it depends without having like all the specifics of the situation, unless you want to provide more detail without, disclosing any HIPAA related information. But they can absolutely file a complaint. All of our members have the right to file a grievance. And even like Alliance staff will file grievances on behalf of members as we're aware of situations too, or can assist in that process. So at any time, anybody has the right to file a grievance with Alliance. They simply can just call the access line and say they want to file a grievance.
I would also suggest if you're if you're seeing problems with grievances, like reach out. If it's supportive housing, reach out to me or Stephanie. If it's, I would always suggest see what's going on, ask. If it's care management, ask care manager, supervisor, manager, reach out, try to resolve that. It goes like on both ends, right? Like if we have issues with providers, we try to go directly to you guys regarding issues. So yeah, I think that's always better. And then, but you always have a right, and our members always have a right to do a grievance, as do providers.
Okay, well, if we have no other questions regarding the Tenancy preservations, we're going to go ahead and segue into our office hours. So at this time, we will start. We will accept questions